So every year, worldwide, 5 lakh ladies are having this cervical cancer. Out of this, 2.5 lakh ladies are dying because of this cancer only. So now we will discuss about the symptoms. What symptoms the ladies are having if they are having cervical cancer. So in case of cervical cancer, as a lady, you will be having the symptom of excessive bleeding during the menses. Sometimes the symptom is that postcoital bleeding PV. That is the bleeding from the vagina after having sexual activity. Another common symptom of cervical cancer is postmenopausal bleeding. That is the bleeding after you are getting the menopause. So along with this symptom, there is also foul smelling discharge from the vagina. And if the cervical cancer has advanced stage, then in that case you are having the symptoms of weight loss, anorexia, fatigue, kidney failure. So now we will discuss about the diagnosis. If you are having cervical cancer, how we can know that you are having cervical cancer? So for this cancer, it is very easy to diagnose the cancer. So now you will ask me how we can diagnose the cancer. So for cervical cancer, there is very important test that is called pap smear. So in this test, what the gynecologist is doing, whenever you are fixing your appointment with your gynac, they are just collecting the discharge that is present on the cervix, and that discharge is collected and sent to the laboratory. In laboratory, we are checking for any abnormal or cancer cells. So if you are having pap smear positive for cervical cancer, then the next step is to go for colposcopy. Colposcopy is again a high resolution camera that is diagnosing cervical cancer in its very early stages. So whenever we are having cancer or whenever we are listening to the word cancer, we are always afraid. We always feel that cancer means cancel. Our life is cancelled. But it is not applied in the case of cervical cancer. Why? Because it is the most common cancer and it is the most preventable cancer also. Why it is most preventable cancer? Because with the help of pap smear test only, we can diagnose the cancer in very early stages. And 80 to 90% of ladies who are having pap smear regular, they can prevent the cancer by doing this test annually only. So how to do this pap smear test? When to do? So after the age of 21 years of age, if you are sexually active or if you are married, then you should go for the test every 3 yearly. Pap smear test can be combined with HPV DNA testing only. This is the HPV virus that is the reason for the cervical cancer in 99% of the cases. So whenever you are diagnosed with cervical cancer, the treatment is also the surgical radiotherapy and chemotherapy. When it is very early stage cancer confined to only cervix, then with removal of uterus, the 5-year survival rate is around 90%. But we are knowing the very famous dictum, that is the prevention is better than cure. So how we can prevent cervical cancer? So for that, since 2006, we are having very important vaccine, that is the HPV vaccine. This vaccine is available in India since 2006. So according to WHO, we are advising this vaccine to every girl starting from the age of 9 years. Till 14 years of age, there are 2 doses of the vaccine. After 14 years of age till 26 years of age, there are 3 doses. So total 3 doses or 2 doses of this vaccine can prevent the development of cancer in your girl child, 99% of cases. In India, Serum Institute has developed one vaccine that is called Cervavac. It is easily available, very cost-effective vaccine, and as a gynec, I will advise all of you till the age of 45 years of age, you should take this vaccine. If you are having girl child starting from the age of 9 years, this vaccine is advisable. Also, you can give this vaccine to your male child starting from the age of 9 years till 26 years of ages. There are 3 doses of the vaccine. So, to prevent the cervical cancer, let's begin our fight against the cervical cancer. So, let's unite and eliminate this cervical cancer globally. Thank you.